Good afternoon, everyone. I'm Jeff Bellows, Vice President of Corporate Citizenship and Public Affairs here at Blue Cross Blue Shield of Massachusetts. Thank you all for joining us today and for this final event in our Wellness Reimagined series. At Blue Cross, we work every day to ensure our members and the cities and towns we're proud to call our customers have access to the highest quality healthcare at the most affordable price possible. That includes leveraging innovative programs and strategies like truly integrated mental health care. Currently, we are living and working through a national mental health crisis while navigating a global reduction in employee well-being and satisfaction. Centering health and resilience at the individual employee level has become a business priority to ensure longer-term employee retention and happiness. Today, our panel of experts will discuss how we can forge the systems and infrastructure necessary to establish and sustain a high quality of life for all employees, while also assessing whether these resources are readily and equitably accessible. Leading the conversation today is Jim Rooney, President and CEO of the Greater Boston Chamber of Commerce. Joining Jim on the panel is the Secretary of Health and Human Services for the Commonwealth of Massachusetts, Kate Walsh, Dr. Kevin Churchwell, CEO of the Boston Children's Hospital, and rounding off the panel is Dr. Sandhya Rao, Chief Medical Officer and Senior Vice President for Blue Cross Blue Shield of Massachusetts. We're grateful to the Chamber for convening thoughtful conversations like today's and look forward to hearing from our esteemed panel. So Jim, I'll turn it over to you to get us started.
Well, thank you, Jeff, for that introduction, and thank you again to Blue Cross Blue Shield for sponsoring this series. This series was launched in reaction to member feedback from the business community and leaders in the business community who felt it was necessary to elevate the dialogue around mental health, particularly in the workplace. As CEOs and managers and supervisors have thought about this issue, and some of the data that I'm sure will come out during this conversation, many times people in those positions don't really understand how best to deal with a mental health situation that is presented to them. And some of this conversation will focus on that. We have three terrific panelists to engage in this conversation, so we're going to get right into it. But first, I'd like to start with some questions that really catch us up with each of these esteemed panelists and their organizations in terms of what they're doing, and then we'll dive more deeply into the subject matter. And if I may, I'd like to start with Dr. Kevin Churchwell from Children's Hospital. Dr. Churchwell, welcome, and thank you for joining us today. Children's Hospital, an iconic institution here in Boston and in Massachusetts, and indeed across the world, has got a lot going on. Most recently in July, Boston Children's and Franciscan Children's finalized an affiliation. Catch us up on what's going on with Boston Children's and how that affiliation will better serve children and families in the region.
Well, Jim, thank you. Thank you for the opportunity to be part of this discussion today. What we've done with Franciscan Children's is to work to address what we see as the true epidemic in our children today. And that epidemic is around behavioral and mental health. With COVID, we didn't see a lot of kids who had COVID. It was not a pandemic associated with our children with pediatrics. But what we certainly saw was an epidemic of children presenting with anxiety, depression, suicide ideation, and suicide attempts that continues today. Now, we could talk for another 2 hours, Jim, and I don't think we have another 2 hours to talk about what the whys. But our work with Franciscans, the affiliation, is our work to address the present and the future. How do we get a handle on this? And how do we actually then support the care and the health of our children moving forward? We believe this affiliation will do that by being part of the continuation of care, or the continuum of care for our kids with these issues. What we're planning on doing is actually remodelizing and creating a new campus at Franciscans that really is concentrated on the care of our kids with behavioral and mental health disorders and rehabilitation issues. What we're seeing is that it is a campus that will add more inpatient beds because we need those inpatient beds for our kids, for our children, adolescents, young adults with these disorders. But that's not the solution, right? We see the future of really creating an opportunity that a campus that has for an outpatient care that is incredibly robust and connected to the community, connected to our school systems, connected to our community health based programs, connected to our primary care pediatric offices. Also a campus that provides the 90s for education, educating the next generation of caregivers. We don't have enough pediatric psychiatrists, psychologists, nurses, nurse practitioners, social workers. And what we're doing is try to do catch as catch can, to find them when we can. But to creating an environment where we are that we are training them, that we're developing them, I think is an incredible, exciting opportunity for the future. And also a campus that is doing the research that needs to happen to improve the care that we're providing for our children with these disorders. What we're doing now, we've been doing for the past 30 to 40 years in terms of behavioral health care, drug therapy. So the opportunity that we have to coalesce that care and develop that is one that we're also extremely excited about.
Well, thank you, Dr. Churchwell. And, as I think about the subject matter today, certainly the mental health of our employees is directly related to the issues that their children may be facing on a daily basis. You certainly just can't go to work and forget what's going on at home or in the family. So Children's Hospital and your strategy and agenda certainly contributes to dealing with the issues that we're talking about today. Secretary Walsh, you're a person known to many. You're running an organization and state government now with, I think, about 21,000 staff across 11 agencies, just a little bit of responsibility. A lot of people know that you spent the last 13 years overseeing Boston Medical Center and have had a long career in the healthcare sector. So thank you for doing that, particularly in our region. About a year now into this new role as secretary. So talk about, that first year and talk about how that prior experience may affect your approach to the job. And within that, what I know you were a champion of health inequities even before you took this job. Tell us how that is a top of mind issue for you and your team.
Oh, great. Thanks, Jim. And thanks for having me. And I'm glad to be part of this panel because it's a really important topic. And I think, first and foremost, what the Chamber is doing and what Blue Cross is doing is really trying to reduce and hopefully eliminate the stigma that comes along with talking about these challenges. So I think it's just such a great step forward that the business community is understanding, the human side of this equation, but it's also a business imperative. We see that as the state's a large employer, but we also provide a lot of care to people who need it. And as Kevin said, we are experiencing unprecedented demand for behavioral health services across our state. And the governors, Governor Healy and Lieutenant Governor Driscoll have laid out 3 key priorities for cabinet secretaries like myself, which is first and foremost equity, making sure that we look at everything we do through the lens of racial and ethnic equity, but also regional equity. So some of the access issues that you see in mental health are different in different parts of the state. Competitiveness, what can we do to lengthen Massachusetts lead in places like Boston Children's, which is, a top-ranked hospital in our country, and how can we continue for those great institutions to survive and thrive, even as we expand equity across this and access across the state. And then finally, we have to do this at a price point we can afford. So demand management is a big part of this. And one of the things that we started on very early, picking up actually from work that my predecessor, Secretary Sutter, started, is this behavioral health roadmap, which really looks to routinize behavioral health care, much like physical health care. So you'll know that there are urgent cares for physical health all over the state. The behavioral health roadmap creates urgent care centers for for mental health challenges. So no longer do people have to go to their emergency room and wait and be in a very distressing environment, particularly with a child. They can go to one of the 25 CBHCs across the state and get urgent care. The other thing that happens is we put together behavioral health services and substance use disorder services. We have them separated sometimes in the healthcare system in ways that just don't make sense to what people and families are experiencing. It's early days for the roadmap. We've just started, but we've seen a reduction in emergency room visits, and we've been able to connect more people to care. So I'm really excited about the opportunity to be part of this panel, but also to really just remind people that a behavioral health challenge is just like if you were having chest pain, you'd go to the emergency room, you'd get treated. If you're having psychic pain, we need to treat that as well.
Thank you, Secretary Walsh, and that's a great transition to my question for Dr. Rao. Blue Cross Blue Shield has really been a leader in working with its clients to address wellness more holistically, and that's something I know that you're engaged in. Talk a little bit about that strategy and how perhaps it has evolved as we have sort of experienced the pandemic and come out of it.
Yeah, well, first, thanks, Jim, for facilitating this, and thank you to the Secretary and, excuse me, Dr. Churchwell, for participating. I'm already so energized by the comments, and it's hard to overstate how fortunate we are in this state to have such committed leadership. I say that as a chief medical officer, as a doc, and a mom, frankly. It's just very inspiring. I'm 3 years into working at a health plan. I was practicing primary care before that. And I would say, I think for many years prior to the pandemic, the concept of wellness and what health plans did with employers was centered on things like fitness benefits and that sort of thing to encourage people to take care of their physical health in a preventative way. What we've seen during and after the pandemic, which I think is a wonderful thing that's happened since the pandemic, is employers are really committed to expanding that concept and bringing the ideas of mental health into those programs. And employers are, really committed to the idea of supporting their employees and their families in taking care of both their physical and their mental health. And so we're really hearing a lot of demands and engagement from employers, the purchasers of healthcare services, to think more broadly about these types of programs and integrate physical and mental health. And the other thing I would say as a primary care physician, I think our employers really understand the importance of primary care in that, and access to primary care that integrates primary physical care with mental health care. And the piece on that with health equity, I think we all know, is that many of the traditional in-person models don't reach everyone. And so there's been a real openness to virtual primary care and virtual integrated behavioral health that has pushed all of us to think about how we bring that in equitable ways. And so that's been the most innovative stuff that we've seen, is the adoption of these virtual primary care integrated mental health programs.
Well, thank you, Dr. Rao. And I'm going to take us into this conversation about mental health in the workplace, first by citing some data that really makes the case for why we're having this conversation today, but also begins to think about a framework for how we can all deal with it. So let me just reference a study done by the United States Surgeon General, Dr. Vivek Murthy, who found that 76% of U.S. workers in 2021 reported at least one symptom of a mental health condition, anxiety, depression, which is an increase of 17% in just 2 years. 81% of workers reported that they will be looking for workplaces that support mental health in the future. So as they're making choices about where they want to work. And 84% of the respondents reported at least one workplace factor that had a negative impact on mental health. So something that was stressful to them about their workplace. Pretty compelling data if you look at 70 and 80% numbers in terms of the reactions to those questions. Thankfully, the Surgeon General didn't stop there, but also issued a framework for mental health and well-being in the workplace, and made some suggestions that I'd like to get each of your responses to. The Surgeon General suggested 5 essential elements: protection from harm, connection and community, work-life harmony, mattering at work, and opportunities for growth as a framework that will help with this issue of stress and mental health in the workplace. So maybe starting with you, Secretary Walsh, what stands out? What's your reaction to the framework that put forward by the Surgeon General to how we all as employers can think about an approach to being on the front lines really in a workplace?
Yeah, it's a very interesting question because first of all, I think it's brilliant, and it's also brave to talk about things like loneliness. And Dr. Murthy's been very public about his own journey through the pandemic in a way that I found really inspiring. And again, it goes to, in my mind, this reduction of stigma. When something, when you break a leg, your neighbors come by and drop stuff off. When it just doesn't happen when people are experiencing depression or loneliness or isolation or any of it, or their child struggling. The kid who is hard to manage in the classroom is a kid who's not invited for play dates. So this starts early on, and so I feel like the calling out the role that the importance that human connection is for all of our health, the public's health, public spaces that encourage interaction, workspaces that encourage interaction. The cubicle culture, people aren't coming back to it. So how do we redesign our workplaces to reflect some of those opportunities for intersection that are laid out in this plan? I think it's hard to do that. It's hard to do that in state government. You mentioned the 21,000 people who are in, probably 20,000 locations across the state, and making sure, and they're also caring for some of the most vulnerable people we serve. So the moral distress of doing that work. I think for the first time, healthcare is talking, and human service providers are talking about the challenge of doing the work that we do. It can be enormously gratifying, but I think it's also important to recognize the challenge. I remember during COVID, in a rather frank exchange with a couple of nurses, they said, "No more muffins. We don't need muffins. We need to feel safe." And I feel so that gets back to, is the workplace safe? In COVID, that was a very dramatic statement, but I think it happens. I think we as employers, we need to consider safety broadly as we try to just be better at what we do. And remember, we're also in the business now of encouraging people back to work. And so what does that look like? And how do people experience the workplace? And what can we do to make the connections that come from in our professional lives sustain us across all of the aspects of our lives?
Yeah, it sounds like you've really sort of latched on to two of the elements of the framework. This idea of protection from harm. No one should
remember all 5, Jim. Sorry.
Yeah, no, I know, but the ones that stood out in your reaction was this protection from harm, and no one should feel going to work. I mean, that's very fundamental to really all of them, right? No one should feel like there's an opportunity for harm. But this idea of connection and community as well was something I heard stand out.
I'll add one more point, which is sort of inclusivity at work. And I think that all of us have learned from our colleagues with physical disabilities of the opportunity for workplace adaptations. I think for neurodiverse people and for people experiencing behavioral health challenges, they're invisible. So how do we understand what we need to do as employers and colleagues and friends for people who might be differently abled because of how their brain works?
Yeah. Dr. Rao, your thoughts on the framework offered by the Surgeon General?
Well, I have great respect for Dr. Murthy. I think he's done so much to shine a light on these issues, and he's been doing it for years. I love the framework. As Secretary Walsh mentioned, I was going to add the stigma piece. We have seen so much progress, I think, coming out of the pandemic, and leaders all over Massachusetts working their hardest, telling their own stories, really to help decrease the stigma around this so that we can get people talking and get people talking about it so they can get the resources they need. I'm interested in my colleagues' perspective on this. One thing we really worry about with healthcare professionals is some real hesitance to report and disclose symptoms for fear that such disclosures will compromise their ability to get licensed and work. And so there's been some real shared work on the part of from all of our sectors in this state recently to change how questions are written on forms and things like that, so that all of our colleagues who are doing the work of taking care of patients, if they have a mental health condition, a substance use disorder, that they do not feel hesitant to get care for those conditions for fear of not being able to do or have a job. And so I think that's been critical. Unfortunately, during COVID, there were incidents with professionals around the country with suicide and whatnot, because they didn't get care. And so we've been trying to figure out how we can do our part in that process to make sure there are pieces of that process. And I'm curious of my colleagues' perspective on that. And then I'll just say, working here at Blue Cross, one thing we've done and on the community and connection piece is we hold a lot of open forum with our mental health staff as facilitators. And it has been remarkable how much people share about their own journeys, so much about their children's journeys. And it is tremendously impactful, to know that you're not alone. Speak about that personally, like just to know you're not alone and what you're trying to do to help take care of your family. It's so powerful, just that piece. And so we find people being really, really authentic in those forums.
Thank you, Doctor. Dr. Churchwell, your thoughts on the Surgeon General's framework?
Well, I think that done a great job of identifying a framework that I think we as an industry can latch onto and understand and try to move forward. I will tell you that it's not easy. We work in a industry that is truly 24/7, 365. And the expectations have always been that's part of the business, and that's what you deal with as an individual, and that's how we thank all of those that work in healthcare. Thank you for doing the next best or putting yourself out, and thank you for this and thank you for that. And then I personally got a lecture by one of my advisors that said, Kevin, you got to stop making them martyrs, right? Because that's not working anymore. That we've got to start addressing their issues. We've got to start really providing an environment that they feel comfortable and want to work in and feel supported in that. And so what the Surgeon General has described is a framework for that, right? But it's not easy. I will tell everyone here, physical support, physical security. Over the past 3 years, our security costs have increased by 4x. And start with millions and just multiply 4x by that. And it's been multiple issues, but certainly what the mental and behavioral health challenges have contributed to that. And so that's just part of what we're confronting. We talk about work-life balance. Well, honestly, that doesn't exist. That doesn't exist in many industries, and I'll tell you, it doesn't exist in healthcare. So we're talking about what it really means. Is it work-life integration? And how do we help everyone think through that and support that? As we started the pandemic, child care was something that we thought we were providing, that it was an add-on and et cetera. And then we found out it was vital. You didn't have a workforce. You can't have a workforce. You can't have folks that can really come to work unless you supporting their children in terms of their lives. And so it's been a rethink around what it means to provide child care support as part of that work-life balance, as part of the evolution of equity, diversity, inclusivity, right? It was a discussion that we all were having but it was brought to the forefront of this is something that's truly important to me. And it's important to how I think about my work. It's important how I think about my life. And I need you to think about it in the same way. And so we've, worked to take on that challenge of how do we actually integrate that piece of work in terms of what we do as a healthcare of a hospital, an enterprise, et cetera. That it's not just an add-on. It's not just something that we think about. We think about last in our agendas, but we think about it first in our agenda or second in our agendas when we talk about what are our enterprise goals, what we want to achieve. Because we're seeing it and we understand it as part of what those that work at Boston Children believe is important for them to be successful in their work, in their professional careers. And so, I think we're not at the beginning, we're not at the end, we're maybe at the end of the beginning, quoting Winston Churchill, but there's still a lot of work to do in terms of, getting to where we want to be in terms of that piece of work around wellness.
No, my team knows that I like to go off script once in a while, but I know this panel can handle it. So starting maybe with Dr. Rao this time, some of the people in the audience, supervisors, managers, even maybe some leaders of organizations, and we have a diverse economy. We've got engineers, we've got financial services people, and mental health wasn't part of their formal education and probably not as much a part of even some of their professional training that, they've supplemented their formal education with. So talk about, how to understand and identify perhaps symptoms in the workforce, how to deal with that employee that comes forward and expresses that they may be, dealing with some problems or issues. I'm looking for practical advice for the people that are listening in their day-to-day circumstances. Dr. Rao, can you kick that off?
Sure, I'll start. I think first off, to create the type of environment, if you're a leader and you lead teams, even if you're one leader and you have one person, just to create the kind of environment where someone would be able to talk to you about this is huge. So, and if I was talking to someone on my team and they were sharing things like this with me, first I would say that the stigma piece of, I think, what Secretary Walsh was describing, that, and I'm a physician, these are physical medical conditions. People should feel like step one, go to your doctor and talk about it. There's a way to get diagnosed. These are, and so that would be my first step, is to make sure, and that's why I was talking about access to primary care. Make sure people feel like they can go to their physician. But what we've been doing at Blue Cross is trying to build some connection points within what we offer to have people be able to come in, whether through our app or call up someone to talk through these. And because we know, some people will be open to going to a physician and talking about getting screened for depression, for example. But there are many people who we know, are sort of subclinical, and we've created some programs that, with partnerships that are, asynchronous in nature. These are kind of self-guided online programs that are available to people, like you say, Dr. Churchill, with schedules that are not going to immediately accommodate going and getting a primary care visit and getting screened, but coach people into creating the space in their lives to reflect and take pause and work on things like as practical as insomnia and stress management and things like that. So that's my first point of advice would be to, if you're with one of us, call and we can help get people into those programs. But I do think first step, I'm really biased as a physician, is to talk to your primary care doctor about these things.
Great. Dr. Churchwell, your thoughts on advice for the manager, the supervisor, or even the leader in an organization?
Right. We've thought about this some, and we continue to work on this, but part of it is asking the question as part of the routine conversation. You talk about how the work is going, what do you need for your work, and et cetera. And then we also are putting in the question, how are you doing? And that is opening up just an ocean of conversation. in terms of the response of how are you doing. And the second part of that is once you ask the question, you get an answer that you weren't expecting or you weren't prepared for. How do we get prepared for it? How do we create programs, opportunities for when we're told, I'm not doing well, or I'm having trouble, I'm having stress in the job. This is why I'm having stress in the job. Do we have the right programs? Do we have the right connections for individuals to go to get support? So it's not just one program, right? We've got multiple programs. We've got a Office of Clinician Support. We've got a Boston Children's Ombuds Office. We've got an Employee Assistance Program. And then the work that we're dealing with is how do we connect those? How do we make sure that they're working well and they're not in conflict and they're working in collaboration, in support? Haven't gotten there yet. But that's the next opportunity for to really get to the heart of how do we support those that work at Boston Children's in this environment. So that's some of the things that we're working on and dealing with as we go forward.
And Secretary Walsh.
Well, I'm kind of laughing because, I don't have a license to practice medicine, although I often dispense medical advice freely. So you probably shouldn't listen to me. But I think that just building on what my fellow panelists said, I think there's openness. One of the most powerful talks I ever heard on this was a hospital CEO, ran a system in Florida of all places, who was very open about his mental health challenges, didn't mince any words, didn't use any euphemisms, and shared this with his workforce and got an incredible amount of support and created, as Sandia said, an environment where people felt like they could come forward. I also think there's a role for the workforce to play in prevention. And, in hospitals, we tend to send the employee assistance team to the floor when a bad event's happened. But at Boston Medical Center, before I left, the EAP team started to fan out more regularly, just kind of like wellness rounds. And, again, can't just be muffins. There has to be something substantive behind it. But the idea that you're there for people kind of in good times and bad, I think, particularly as an employer, you can't, somebody's having, an acute psychiatric issue as their supervisor or manager, you cannot deal with that. And it's also incredibly disturbing to the people around them. So you have to be really, it's a workplace. It's not a therapeutic environment. So I think the idea of creating a space where people feel that they can talk about this, they can get the help they need without fear of reprisal. Our state has one of the most generous personal family leave acts in the nation. That's really very people-centered as opposed to illness-focused. I think is also a very important tool. People, listen to what you say, but they watch what you do. And, does somebody get their job back after they're out for a couple of weeks? All of those steps that you take as a leader, you can't treat psychiatric illness in the workplace, but you can do what you can to prevent or reduce the stress that can lead to it.
Tim, the one thing I will add, as I say, my go to your primary care doctor statement, one thing that is well known is that, and the Secretary's team has done so much on this, that navigating the system is very, very confusing, even for some of us who consider ourselves very savvy. And so I think all of, the local health plans and now the state have created front door, quote unquote, to help people understand, what exactly are you dealing with, you or your family member, and based on that, what are the different levels of intervention? And I myself have learned about a lot more resources I didn't know about. And so just to anyone out there, if you are sitting in a conversation with somebody, and whether it's, wow, I kind of don't feel like myself, or, oh my gosh, my child won't go to school, that range there. And again, I just say in our state, there's just been so much tremendous amount of effort to create, a front door that can sort of take all of that in and guide people. And most of us plans now are sort of guiding people. We guide people to the point of getting an appointment. And then, did you go to the appointment? Did it work for you? And we've all realized there's a lot of value of navigating to that level because it takes that much of determination to get people into the care that they need.
And Jim, if you'll just indulge a shameless plug. So in January, the state started a behavioral health helpline, which is open 24/7, 365, offers phone, text, or chat support. Because our teenagers aren't picking up the phone and dialing, they're texting and doing however else they do things. But so we really tried to have many places for people to reach. And 44,000 people have called that line since January and had a warm handoff to services. So, it's not perfect, and there's, accessing behavioral health services are as hard as accessing primary care services in our state, but we're really looking to make sure that people know that they have that. The other thing is that, and I meant to say this, and it speaks to the equity point, as an employer, you need to understand that people come to the workplace with their own constructs about behavioral health challenges. So culturally competent care in this space cannot be overstated. Like, it is, something that would seem like a routine inquiry to me could feel like a big insult to somebody else. And I've done that as a leader, trying to be helpful, but not knowing how. So increasingly, we're looking for peer support, for people who look like you, who speak the language, who can help you navigate a system that may not be designed with some of your cultural norms in mind.
Thank you for making that point, Secretary. Kevin, did you want to get in?
Yeah, I just want to add on to just the great comments that have been made that, part of the opportunity also is the use of technology, as we talked about, that the use of telemedicine, telepsychiatry is something that should just continue to be enthusiastically supported and spread, because it creates access. It creates the opportunity for individuals that need help to get help. Yeah, it's almost possible to get an appointment with a psychiatrist now. Okay, if you're trying to get an appointment with a psychiatrist in their office, how about you wait 3 months? How about you wait 6 months? As opposed to, how do we utilize the technology that we have to get folks the help that they need as soon as possible? And so I believe that, these apps, telemedicine, telepsychiatry are going to be extremely important. So that's the positive side of what we have available. Certainly there is the negative side in terms of social media, and I don't have TikTok, so I don't really know, but all of that stuff, and X and et cetera. But how do we leverage the positive is going to be also important moving forward.
Secretary Walsh, did you want to add to that?
No, I think it's really important. It's really important also for some of the cultural language specificity. I think that's much easier to get and I think there's a prevention aspect to this. I think there's an early intervention aspect of this. We all know what to do to keep ourselves physically healthy. Increasingly, we know. Dr. Rao mentioned sleep. There's apps that can help you with sleep. I think there's just ways to think about how we tackle these challenges that, again, if we can reduce the stigma, create broader access, and then funnel the people who actually need psychiatric intervention into the right place, which, by the way, is not your local emergency room. I think it's going to be a really important, it's going to be important steps in addressing what feels like a tsunami of need out there right now.
So, questions from the audience are beginning to flow in here in response to this conversation, so that's great. So I'll try to weave those in, and I want to get back to some that I have on my mind as well. But let me pick one here that maybe Dr. Churchwell will start with you. To what extent do you believe managers should be willing to discuss an employee's feelings of burnout without at the same time questioning their commitment to the job and the firm? That's interesting.
I don't know if that's, as I've worked on this and thought about it, I don't know if that's the right question. In that then puts a judgment into the analysis, where in reality, in order to get to the best solution, at times you have to, and many times I believe, you have to put judgment to the side, meaning that we should and need to develop the right responses or the right programs or the right places to go when an issue arises, right? When an issue arises around an employee's concerns around their health, right, and how it affects their work, how it affects the job, or et cetera, that can be evaluated appropriately. And it's not the manager's job to evaluate that appropriately. They didn't go to school, right? They didn't go to school to do that. I didn't go to school to do that. And so it is our responsibility to create the right framework and the right program so that that can be evaluated appropriately and supported appropriately. And that's the discussion that we're having here. Again, it's not a perfect environment here, right? We've got a lot of issues and questions around that. But how do we actually eliminate the judgment call and create an environment where the issue is presented and we address it appropriately? I think is the next evolution for us to get to the heart of it.
Maybe I'll go to Dr. Rao and not ask the secretary to practice medicine.
I think she'd do great.
Dr. Rao, thoughts on, a manager confronted with an employee expressing burnout? And I like Dr. Churchwell's answer was great about the judgment part of this question, but this question of the commitment of that employee to the work, to the firm, to the business, when they're expressing burnout.
Yeah, I mean, I don't relate the two to one another at all. I think, in my opinion, if you have a sense that you see a change in someone's behavior at work, or someone's feeling open enough to say to you that I'm feeling some burnout, I think personally what I've learned is my advice is to give people the time that they need to address that. So I always say to my team, you can't just push those things aside and keep cranking out the work. You really need to set some time aside in your own personal lives to make changes to address that. So I think it's time well spent on the part of teams to address whatever's contributing to burnout. And personally, I think if someone is really honest enough to say to me, I'm just having a hard time here, can you help me out? It's a sign of commitment to the organization that they really want to deliver and be a part of the team, but something's going on. And I think that's a very healthy thing to surface, and to think about, ways where you say, why don't you take a couple of days, get things in order? Do we need a break point and make change? Because it just can't go on forever. I mean, bad things happen. We all have so much important work to be done, especially, I'm saying this to my colleagues in healthcare. It is natural in this field and in all sectors that people are going to have these periods in their life where they're burnt out. And if you're going to have longevity in these roles, I think it is on the part of leaders to surface that and take some time to talk about it.
Thank you. You've all made reference to workforce wellness in the medical sector, and we're talking about workplaces, and here in Boston, it's one of our largest industries. We've got sort of a disproportionate number of people, perhaps, compared to other cities working in the healthcare space. So I want to give you an opportunity to discuss sort of what your observations are, particularly coming out of the pandemic, about workforce wellness in that sector, in your sector. You've each been leaders, and talk about what's going on. Talk about some of the interventions, perhaps, or the policy strategies that have been developed. But do it, please, in a way that maybe people in other sectors can say, "Oh, okay, that might be something that might work in, I don't know, technology, financial services, or something like that." So maybe Secretary Walsh, I'll start with you, and you're calling back to your 13 years, I guess, at BMC and other experiences about, how has workforce well-being evolved in the healthcare sector, and how would you describe it today?
Well, I think we've sort of hit on. I think from a general business sense, there's a growing appreciation and understanding of two really important factors. that drive productivity and sort of economic value in our society as it relates to healthcare. The first is the inequity in health outcomes that we see by race and ethnicity. Blue Cross did an important piece of work that said that costs all of us about $5 billion a year. So understanding that, appreciating that, looking at health outcomes by race and ethnicity across physical and behavioral health is absolutely like a no-brainer from a business community. And employers who make trucks should be focused in on this because it costs them more. We all spend way too much of our disposable income on healthcare in our country. So that's the first thing. And the second thing is the concomitant productivity drag of behavioral health challenges, not only in the workplace, but people bring their families and their whole selves to work. So as an employer, you care about the integration of behavioral health services in our high schools. If you've got a troubled teen, and teenagers by definition are trouble, but if you've got a really troubled teen, when your child goes to one of the local high schools and there's one adjustment counselor for 1,100 kids, that's coming into the workplace for you. So I think the growing awareness that as business owners, as people who are trying to add value to our society, these two factors are really important to overall productivity. So investments that you make that might seem incredibly expensive, a day off, or time for parents to spend time at their kids' school, are actually very low cost interventions, because ignoring those challenges add to much higher costs in the end. So that's kind of how I think about it. It's easy to say, it's hard to do. And it's also hard to do equitably and fairly, because people say, whoa, why is this guy off every Friday? It could be that he's taking his kid to therapy, but what does that mean in the workforce, and how do you manage that? And how do you use the flexibility that we all learned to live with during COVID to accommodate that without increasing the isolation and loneliness that came along with it? It's a trick, and it's not easy, but I think we have the skills to do it. And increasingly, and I think Kevin touched on this, there's a role for data, because we need to understand more about these illnesses and figure out who we need to treat immediately. How do we, how do we kind of use predictive analytics to say, okay, and if there's 100 troubled teens, these 10 we really have to watch out
for. Dr. Churchwell, I think Secretary Walsh teed up a few things for you there. Would you like to join in?
I think she covered it. I think that the view of
nobody wants to touch teenagers.
the view of really thinking about how do we integrate this work into our workforce strategy, not as a separate entity, but it's vitally important for us to develop the workforce and have a workforce that's engaged, involved, and working at the top of their level. Is what we are truly starting to recognize. Also, that it's okay to change. Change is important. And holding on to the old stuff may not be as helpful as we thought it was. An example is just remote work, right? In that prior to March of 2020, the expectation is everybody came to work 5 days a week, and some, et cetera, et cetera. And we found out pretty quickly that, we could still be pretty productive and that not be the case. But we also found out over a period of time how it added and supported wellness if we continue to work to incorporate it into how we did our work. And so that's just one example of as we move forward, how do we continue to change and take opportunity and listen to our workforce about their views and their ideas about how that can evolve and how that can support the work that we do.
Dr. Rao, I'm going to throw a little bit of a curveball here. I'm going to ask a final question, ask you to kick it off, and each of the panelists to comment quickly so we can wrap this up and give people back a few minutes.
Yeah.
And I know that each of you are curious, lifelong learners yourself, and the question that we got in the chat, along with one that I had on my mind, is around best practices and seeing ideas that maybe you've seen and say, wow, that's elegantly simple and, a good practice. in the workforce for people to engage in. Anything you've seen in your conversations with some of your clients, or I mean, maybe in the case of Secretary Walsh going on in other states, that might be interesting to think about.
Yeah, well, one thing I want everyone to know is there's a tremendous amount of innovation happening. I'm speaking to my tech colleagues. I think the workforce dilemma in mental health, which is there's never going to be enough for a one-to-one. We're finding some really creative new care models driven by technology, by the types of analytics that Secretary described, that people should feel very hopeful that there is access and capacity in the system to get care. And so, I think all of us health plan leaders are trying to figure out how to create tools to surface those. But that's just one thing I'd want people to take away is there's a tremendous amount of innovation to create capacity, and people should not feel like, well, I've got this problem. It's not big enough to warrant getting taken care of. There is care for everybody because of the innovation that's, a lot of our colleagues in other sectors are bringing to this problem. And most of us health plans are really working hard to change the way we serve that up so that it becomes really accessible to people.
Thank you. Dr. Churchwell, thoughts on, innovation in this space?
Well, just the idea that in order for us to continue to find solutions, that's a key component of creating the environment where we support innovation in the space. That and not just happenstance, but we intentionally do that. We have departments and individuals that are responsible for pushing innovation. I think is going to be really important for us, so that it's brought on a regular basis to us in terms of our planning and execution. We've thought about research in that regard. We've thought about clinical care in that regard. I think this is another environment that we should put that type of planning and execution to bear.
Secretary Walsh, closing thoughts on this subject?
I think drafting a little off of what Dr. Churchwell said. I think many of these are biological processes. We have medicines that can be effective, and there's continued research, and many of the great medicines will be developed right here in our state. So we should take advantage of them. On the other end of the spectrum, I think we're increasingly appreciating the role that people with lived experience, particularly in the substance use disorder, but also in behavioral health. How do you manage keeping a job when you have a behavioral health challenge? And there are people with lived experience who can do that work. We need to support those peer counselors because it's hard work and it can be triggering. But I think there's a way for us to, again, it reduces the stigma, and there's I think a benefit to experience, much like cancer support groups. What can we do to help people who have been on this journey before you? How can they smooth the pathway for you? And I think that increasingly our reimbursement systems need to recognize that, and certainly our care delivery models need to change to incorporate the roles of peer counselors.
Well, thank you. And we're going to wrap it up there a couple of minutes early just to give people a little bit of time to sort of stretch and maybe get some water before their next meeting. We run from meeting to meeting on these Zoom calls, I know. Dr. Rao, Dr. Churchwell, Secretary Welch, thank you so much for your expertise and this conversation and the helpful nuggets that I'm sure our audience took away. Thank you to Blue Cross Blue Shield for making this series possible, but for more broadly elevating the conversation about mental health and workforce well-being. Thank you for your leadership in that space. And post-event, we'll be sending out a resource guide to the attendees with mental health and well-being articles and other information that we've collected. So stay tuned for that. Again, thank you to our panelists, and thank you to all who have joined us today. And to each of you, have a healthy and safe holiday season.
You as well.
Thank you.
Thank you. Bye, everyone.